We're very happy that our urban stream is spread out in a bunch of urban sites within Winnipeg. There is Kildonan Medical Centre, which has been a teaching site for decades, and it is situated within Seven Oaks Hospital. There are also 3 of what are called access centers that we use, which are community-based primary care clinics. So there's Access Winnipeg West, Access River East, and Access Fort Garry.
Access Winnipeg West is located at the Grace Hospital on the banks of the Sturgeon Creek. We are organized with 2 resident practices, both of which have 2 attending physicians for them. So 2 kind of teams that we've set up for our residents.
I think the most important thing that residents leave with is the sense that they can be family physicians and they can be confident in their skills, they can be confident in their abilities, and we try to make sure that everyone who leaves feels confident and competent, that they can run their own practice, run it successfully, and be really strong family doctors.
The learning environment is very supportive. Not only do we interact with the Tangs, but we also interact with a lot of additional providers.
You see a bunch of different clinical presentations, a bunch of different degrees of acuity in the presentations, and complexity of the presentations. And I was born and raised in Winnipeg, so it's nice to stay close to home.
Our residents have lots of opportunities for teaching. We host learners from many of the colleges in the Faculty of Health Sciences, as well as junior medical learners. So our residents have a lot of opportunities both for clinical teaching as well as for didactic teaching sessions like clinical skills.
I want to work in an urban center and in the city, and I find that working at an access center allows me to better understand the communities that I will be working in, and it helps me understand how to work on a team and how to work with allied health. I'm so glad that I picked Access River East because I feel like I fit in, and anybody that comes here feels like they're part of a family.
So Access Fort Garry is located in the south end of the city, so closer to the main U of M campus. So we have geriatrics, we have palliative care, mental health, addictions, as well as complex care and family medicine. So there's a nice wide variety that's offered here.
The training and the focused clinical experiences that we have set up here at KMC is rich and sufficient to enable our residents settle into unsupervised, independent practice anywhere they choose to work on graduation.
I would say KMC is one of the most supportive places I've worked. A lot of residents have different things going on in their lives, and so if anything comes up, everyone's been so wonderful to talk to. If you ever either need a day off to deal with certain things or have someone kind of cover for you, you'll be able to have that support here.
It's a great program for somebody who really wants a good core family medicine training, who wants to learn from some great preceptors and still wants to get that broad experience in their family medicine training.